Hi, I'm Margot Mains. I am the Chief Executive of Illawarra Shoalhaven Local Health District. Our patients, their families and carers are at the core of everything we do in health service delivery. In New South Wales, 1 in 8 people are carers for their family. Every day we work together with carers when providing services and care for our patients. We rely on them as they know their family members best. They can very much help us as we undertake identifying needs and also help us in delivering the best services possible for these patients. Stories that you all are about to hear will give you a greater understanding of the importance and the true value of the role that carers play in the care of the patients. Under the New South Wales Carers Recognition Act of 2010 requires all of us to consider the needs of the carer and include them as partners in care delivery. I encourage all of you to listen, to reflect upon what you hear today about the value of carers.
My name is Trish and I'm a full-time primary carer for my husband who was diagnosed with motor neurons disease 3 years ago, diagnosis, and onset 4 years ago. His speech is greatly affected, so he's on the other end of the phone. People just think he's drunk or just don't give him the time to explain what he's trying to say. So I make all verbal appointments, speak on his behalf, which is not always a good thing. He would still like to communicate. People just have to be a little bit more patient and let him get his words out. So I do all the primary phone calls and make all appointments.
Okay, well, my name's Sonia Facey. I care for my son Nathan. He has autism. He also has an acquired brain injury after being hit by a car back in 2010.
Well, I'm Helen Knight and I care for Robert Knight, my son, who has cerebral palsy and mental retardation. I have looked after him all his life. He's 51 now. Being a parent, you kind of feel sorry for them and you try to want to do everything for them. And that you can't do because they've got to learn how to do things for themselves and that when the parent is not there no more.
Well, I'm Ernie Payne and I look after my wife, Janice. She had a stroke in 2014, and another one 2015, and I've been looking after her for that whole time as a carer.
Hello, my name's Joe Wilson and I'm a carer. I care for my 92-year-old mother and my 24-year-old son. 16 months ago, my son, who was 23 at the time, had a major medical incident, and he actually scratched a staph infection into his blood system. And in Wollongong Hospital he had 3 strokes. He had open heart surgery and was in RPA for a number of months. He also started having epileptic seizures, and they're fairly, big seizures, and his neurologist has requested that he goes to hospital every time he has a seizure. Discovered additional issues as the year has gone on, in that he's blind in his lower left quadrant, his hearing is impaired, he's constantly tired all the time, his short-term memory is not very good. He has a lot of balance issues. The responsibilities that I had was obviously organising all his appointments and getting him to those appointments on time. For the last 16 months, I've had 2 sides of the coin to look at. One with my mother being 92 and working through the aged care process, and also finding out that she has the onset of dementia. And I guess my carer's journey actually commenced with Joseph going into hospital. There was a lot of medical procedures, obviously, and we dealt through the whole process of heart surgeons, neurosurgeons, psychologists, psychiatrists, occupational therapists, speech pathologists, physiotherapists, and went through the whole process of, getting Joseph back on the road.
He has had to go to hospital. He put his arm through a glass window, and it was a pretty horrific injury. We got there about 9:30 at night. We had to sit through till 7:30 in the morning to see a surgeon. Up to this point, we'd had to have Nathan sedated for the whole experience because he can't sit quietly for very long. Communication within the hospital seems to be a bit disjointed, can I say? Because we were told to be at the hospital at 8 o'clock for an MRI. When we got there, they said, "What are you doing here so early?" I said, "Well, we were told to be here this early," and they said, "Well, we don't even have any beds ready till 9 o'clock." And we're just sitting around, and Nathan was getting agitated, and he hit himself a couple of times, and he hit me. And then when we finally got him to bed, we were there at 8 o'clock, and it wasn't until after 11 o'clock that he actually ended up going for his MRI. In that time, he decided to shred a blanket while he was in there because he's so agitated. So he's just, ripped a blanket apart, which was not much we could do about that.
Other than the main hospital, we've had to go to specialists, rehab doctor. When we left hospital, she had the stats people look after her. I've got to go to the doctor once a month or 6 weeks with my wife.
We deal with occupational therapy, speech therapy, hydrotherapy, social workers, physiotherapy, neurologists, pathology. So right across the spectrum, but we are lucky we deal with the allied health group, so those services are combined together, which give us a much easier access to everything. By having this one-stop approach that we are dealing with, it is fantastic, and they just help me in immense ways.
Actually, you don't have a life because you can't go out, not unless you take the person with you, and you can't meet people. Even now, Robbie won't stay at home by himself, so he's always with me. I always take him everywhere. You see all your friends going out and everything, and no, you're still at home. So you really don't have a life at all. My health has stopped me too, but yeah, because I've got a lot of things wrong with me at the moment, and it's hard when you have to look after them at home, and you've got problems yourself. All I can say is it's been really hard. For 51 years, it has been hard.
It's had a great impact on me, both mentally and physically. I've got to manage everything to do with her. From when she wakes up in the morning, I get up early in the morning, have a stress-free couple of hours by myself. By 8 o'clock when I get her out of bed, or the girls get her out of bed, that's when my stress starts. And it's just sort of tiring, having got a life. And even when I'm in town, I'm worried about her. And even when I'm asleep, as one person said to me once before, do you wake up with one eye open all the time? And I went, yes, because I've got to keep an eye on it.
Emotionally, it does take a toll. I mean, my marriage fell apart a few years ago. As a caring mother, I just had to, carry on and do the best I could by Nathan. I don't sleep that well. Physically, it's Nathan. Dealing with Nathan has taken a pretty bad toll on me. My body is on my shoulders because he's violent, hits me. It does take a toll on your whole life. Changes everything. Changes the way you've got to live your life.
My day starts off. My sleep is interrupted because I know I have so many things to do during the day. You get so much reading literature, but as a carer, I don't have the time to read it. There is just so many things in our day that we need to fit in. There's no such thing as a lunch break or a morning tea break. I add them together and I just try and do things around the house, bring washing in, put washing out, get bathrooms tidied. So that's the ongoing for the day, and that just continues throughout the day until bed, every day.
It is extremely important, I think, to get an understanding of what the carer actually goes through, because it's a complete change of life. 1 minute working, full future in front of you. Then of course next minute you're caring for obviously your son full time and my mother. I had to give up work totally, which became a financial burden, for us as a family as well. As a carer, you have to look after yourself. And I found that quite strange because I guess I've always been pretty focused, and if that's my function and that's my job, I get on with it. But what you find is over time that even if you haven't got outward signs of depression or fatigue, internally it does show up, and it can show up in a whole range of different ways.
As a working carer, and I work for the health system, I've only started working from home 4 months now. Previous to that, I was full-time at work, and I took pride in my position. So I actually thought that I would be a valued employee, that they may help me to transition and to come back. To put it bluntly, my husband has a terminal illness. He is going to die. But whether it be 1 year, whether it be 5 years, if I can keep something to come back to work after, because I will have to come back to work. It isn't if, but, or maybe. I will have to come back to work. So if I could stay employed with my job, it takes an immense amount of pressure off me to know that I have a position to come back to.
The carer is very important in this whole medical process. In terms of a cog in the wheel, this is the driving of the wheel. This is the person that is there day in, day out with that individual person. The carer needs to be included in all of this because they're actually doing the majority of the coordination, the work, the caring for that particular person, and they know, the ins and outs of it. I guess an example is, every time any medical practitioner, whether it was the nurse, the physio, they'd say, "How are you, Joey?" He'd say, "Really good." And he wasn't. I knew that. And so I would always have to, butt in, if you like, and just say, "Well, look, that's all well. Yes, he's doing quite well. However, this is a scenario, this is what he's saying to me." And I guess a perfect example of that was I went to see the psychologist. And it was only at that point that the psychologist sort of pulled me in and said, "Look, Joey is suicidal." No one knew that. So the patient, in a lot of occasions, I guess, doesn't tell you the whole story, but the carer knows the whole story because they're living with them day to day. So I think an establishment needs to be made up front. Who is the point of contact? And in my circumstance, me as the carer was the point of contact for all medical procedures.
Yeah, I have to be there for everything, to explain his situation, to explain why he is the way he is and what he needs and how to care for him. The staff up there always check to see, they've always checked to see if I was okay and if I needed anything. They would definitely need me there because he doesn't speak for himself. But I understand him. He's 16 now. I've been there with him through all the experiences, so I know how he reacts to different things, and staff have to understand because he can just all of a sudden be violent just out of the blue, so I have to be there to explain that too.
But it's very stressful, especially they give her information and I'm not privy to that information. So they knew my wife had the stroke, but why were they talking to my wife and not to me? That's important because then I know, because I'm the one looking after her, and she got a little bit of loss of memory. When my wife come home, they expect me to do the exercises, or keep reminding her to do the exercises. Well, I've got a lot of other things to think of, and I can't keep thinking of, I don't know what's going on, then I can't do the bits and pieces for her. Or there's a problem with it, and they don't tell me, then that puts me at a disadvantage.
When he has to access them, I go with him. And because Robbie won't tell them what's exactly wrong with him. He'll tell me, and he won't even tell them when they're hurting. Like when he went to physio, he wouldn't tell me if they were hurting, or he wouldn't tell the doctor. But he'll tell me when we go outside. It's important that they have to know that the carer has to stay there, because Robbie won't stay by himself. Even though he's 51, he won't stay by himself. So I have to stay there. I have to stay there all the time with him. You've got to let the carer know what they're doing to the person, and not talk over the top of their beds to one another. You need to include the three people when you're there beside their bed. You need to tell the patient, the carer, you need to tell.
As a carer, we often don't show how we're feeling. It's not until later on, after the ordeal you're going through is over, that you let your guard down and you become emotional. So it is important for staff to just check on the carer as well. For us, it's a difficult journey seeing our loved ones go through what they're going through, and we need the support too.
Everything might look all right on the outside, however deep down, underneath that, there's a lot of issues. Life's not all good at home. Because of brain injuries or whatever, and the person becomes very unstable at home but won't do that in front of other people. There's so many other hidden elements within the patient-carer relationship that the medical staff needs to be cognizant of at all times.
It's been said to me a few times that I come across quite strong and assertive and outgoing, and reality is I'm not. You just put on a brave face for everything and for everybody. Our life is taken away from us because we become a full-time carer, so we no longer have an independent life. But in saying that, I'm still a wife, I'm still a mother, I'm still a grandmother. So I have to fit all these other things into my life as well. So if a worker comes to me, sometimes I'm not doing okay. One day you wake up, you find that there's a terminal illness or an illness in the house, and you are suddenly expected to know how to care for these people. I have no medical training whatsoever. So if a health professional could just take that little bit of time, maybe a one-on-one where we're not with our loved ones, just to see, are you okay with this? That would be good.